Here are some complications of gastric or peptic ulcers. So peptic ulcers form due to increased hydrochloric acid, increased acid secretion and increased acid susceptibility of the gastric lining and impaired mucosal defense. The complications include CHOMP, so C for complications, H for hemorrhage, O for obstruction, M for malignant transformation, though that's very rare, 1%, and P for perforation. So, when might one of these ulcerated stomachs or the ulcer hemorrhage? Well, acute bleeding can occur, and that acute bleeding will present as an acute upper GI bleed. Remember, any GI bleed above the ligament of Treitz is considered an upper GI bleed. So you would have melena, which are dark black tarry stool due to it being so far up in the GI system. And you would have hematemesis if there is quite a large bleed. So hematemesis of coffee ground vomitus, okay? So it would be quite dark coloured blood. So it suggests kind of like old blood as well. And is it a minor bleed or is it a major bleed? If the gastric artery or the splenic artery becomes involved, it's considered a major bleed. If there is some kind of stenosis due to the ulcer, so this is the pylorus, so this would be called pyloric stenosis, or if there's a duodenal stenosis in this area, that would cause obstruction and the food would not be able to progress down the GI. So that it presents with bowel obstruction, so failure, so that would have symptoms of vomiting, failure to pass stool or flatus, and you can even get the lesser curvature, which is this one, and the greater curvature is this one. You can get a lesser curvature deformity known as the hourglass deformity because the obstruction is that serious and that stenosis has progressed to that extent. Malignant transformation is very rare, with only 1% of chronic gastric ulcers turning malignant. Perforation, however, is an acute abdominal surgical emergency. This is called an acute abdomen. The perforation occurs when essentially the gastric ulcer erodes and the gastric ulcer, the stomach contents, all perforate, so they burst through into the abdominal cavity, and as they burst through into the abdominal cavity, that can lead to pneumoperitoneum or air in the peritoneum. So when air enters the peritoneum, it can present with air above the diaphragm. So pneumoperitoneum can present with air above the diaphragm. This is free air under the diaphragm. Are you